Pleasure to report on my activities as Australian-New Zealand Director of ISTAP over the last 2 years. I am very grateful for the support I have received from my ISTAP colleagues and many clinicians in Australia and New Zealand, as well as industry, in fulfilling my role. I have chosen to highlight my interactions under collaborations, promotion of ISTAP, and participation in ISTAP activities. In terms of collaboration, an introduction to Dr. Anthony Dyer, CEO of Wound Innovations, to ISTAP has led to the signing of a Memorandum of Understanding with Wound Innovations and the opportunity to review and share Wound Innovations skin-safe resources that focus on maintenance of healthy skin and management of skin tears and access to a photo library of skin tears. Connections have been established with New Zealand Wound Care Society through committee member Mandy Pagan. Mandy is thanked for her valuable advice on issues relating to skin tears in New Zealand, as well as her contribution to the presentation Skin Health, Clinical and Cultural Perspectives, Australia and New Zealand, where Mandy highlighted the complexity of cultural and societal issues facing Maori and Pacifica peoples in the delivery of skin health and wound care. Numerous calls regarding skin tears have been received, especially from aged care facilities who have been directed to the ISTAP website. Promotion and collaboration with the World Council of Intrastomal Therapists has been enhanced with the inclusion of ISTAP goals and activities within the World Council of Intrastomal Therapists Journal. The ISTAP World Without Skin Tear Days have been advertised for both 2023 and 2024. Within the News and Views section in September 2023, our President Samantha Holloway wrote about embedding the International Skin Tear Advisory Panel's skin tear classification into practice. This June, Professor Karen Uzi, President-elect, will be providing the editorial, and ISTAP will publish an article on essential skin care and maintaining skin health. Thank you all. I hope to be able to promote ISTAP at the forthcoming World Council of Intrastomal Therapy Congress in Glasgow this September. Promotion of ISTAP has occurred in conjunction with several other organisations. During the Wounds Australia Conference, September 2022, and within the Skin and Wound Assessment Workshop in conjunction with Nicole Flannery, Nurse Practitioner Wound Management, I presented a segment called Potpourri, Some Reflections on Skin Assessment, within which the ISTAP organisational structure, benefits of membership, the ISTAP classification tool, ISTAP publications, and resources kit were reviewed. Nicole is also thanked for her support and promotion of ISTAP and other formal guest speaker presentations. In addition, I also hope to promote ISTAP at the Wounds Australia Conference this October. Similarly, during the Coloplast Aged Care Summit in 2023 in Melbourne, a presentation on skin tears, applying the evidence in complex cases, the role and function of ISTAP and clinical application of ISTAP's resources within aged care facilities was demonstrated. During Rural Health West Wound Education Study Days in Kununurra in the far northwest of Western Australia, and Narrogin in the southwest of Western Australia in November 2023, lanyards with ISTAP skin tear classification tools were distributed to over 60 delegates, doctors and nurses, and associated hospital staff. For the World Without Skin Tears Day in 2022, a presentation on bruising in the elderly and the link to skin tears was given. Facilitation of invitations to guest speakers Professor Carolyn Carville and Professor Fiona Wood occurred in 2023, and to Dr. Chloe Jantz and Dr. Jill Campbell for 2024. In conjunction with other ISTAP directors and for the Wounds International Digital Event 2023, a presentation entitled Skin Health, Clinical and Cultural Perspectives, Australia and New Zealand was given. I joined Samantha Holloway and Professor Ray Samuero in co-authoring an article, Preventing, Assessing and Treating Skin Tears. The article was published in the UK Nursing Standard in 2023. I am also a member of the Collaborations and Partnerships Committee. Thank you for the opportunity to highlight some of the activities undertaken for ISTAP. For our Australian and New Zealand listeners, please do not hesitate to contact me for further information or assistance with skin tears.
Thank you very much to our Regional Director for Australia and New Zealand. We're now just going to move over to our presentation from our Regional Director in Middle East. And again, I'm just going to remind all of our attendees while you're online here, if you are tuning in from one of the regions that our directors oversee, please, as Jenny was mentioning there, please feel free to reach out to ISTAP to get in touch with your Regional Director if you have ideas or you need more resources or you want to contribute more to ISTAP. We'd always be interested in hearing your thoughts and feedback. So I'm just going to pull up our next presentation from our Regional Director, Middle East.
Greetings. I am Salvacion Cruz sharing the ISTAP activities for Middle East. I am situated in Abu Dhabi, United Arab Emirates. I am working in Sheikh Khalifa Medical City for 19 years. Completing the IWCC from University of Toronto in 2009 and being the facilitator in UAE of the IWCC from 2012 to 2023 gave me an opportunity to have communication with the wound care enthusiasts in the Middle East. Initiated the first Skin Tear Awareness Day in our facility attended by 50 participants. Sharing ISTAP in local and regional education and conferences whenever I'm presenting. ISTAP was represented in the 15th Abu Dhabi Wound Care Conference held last March 9 to 10, 2024. This was attended by 1,400 plus participants around the globe. On this day, around 100 participants attended the Skin Tear Awareness Day with approved 5-hour CME. I would like to extend my sincere acknowledgement for their support in my ISTAP roles.
And thank you to our Regional Director, Middle East, Salvacion Cruz. We're now going to move over to our presentation from Annika Furi, who will be doing a quick presentation on the region of Europe.
Good day, my name is Annika and I am ISTAP's Regional Director for Europe. By attending this ISTAP event, you are showing your interest to learn more about skin tears. Thank you for your hard work and your dedication to help us raise awareness of skin tears and make a meaningful impact in our patients' and residents' lives. Within the allotted time, I would like to briefly highlight some of the events, activities, and research projects from Europe. Events. ISTAP delivered 2 Made Easy sessions at the Wound UK conference in November last year. The sessions examined the differential diagnosis of skin tears, as well as first aid measures, reapproximating a skin tear flap, and also using the ISTAP classification system for skin tears. The sessions were attended by over 100 delegates with very positive feedback. At the upcoming 34th UMA conference in London in May, 3 joint sessions between ISTAP and UMA are planned. A workshop, focus and key session conducted by various of our board members, together with an industry-sponsored symposium focusing on various topics within the domain of skin tears. Highlighting some of the activities, ISTAP, again in collaboration with UMA, is working on an exciting project to record the experiences of patients living with skin frailty or skin tears, and also record the healthcare workers' experience working with these patients or residents. The initial recordings will be done in Belgium and in UK. From Europe, we're also working on developing a skin tear data collection tool, which will go through content validation by all ISTAP board members. But the aim is to provide you with an easy tool which can assist you in collecting prevalence or incidence data within your hospital, nursing home, institution. Thinking about research projects, we know that medical adhesive products can potentially cause skin tears. So Professor Mats Eriksson from Örebro University in Sweden and Professor Beekman from Ghent University in Belgium is leading an exciting research project. The main objective of the TAPE project is to explore the impacts of medical adhesive projects such as surgical tapes and adhesive wound dressings on patient discomfort and pain. This investigation will focus on how the selection, application, presence and removal of these adhesives can affect the patient's well-being, with the ultimate goal of guiding further improvement in development of available technologies. Additionally, an Italian group examined which nursing interventions increase the risk of skin tears. This was an interesting systematic review reporting on 17 articles and concluded which nursing care practices can affect patients' skin health. Think about nursing practices such as how we clean the patient's skin, moisturizing, which products we are using, how do we transfer our patients, how do we handle our patients. So worthwhile a read of that publication, and I've put the footnote for your perusal. This year, a master's student from Ghent University in Belgium will also be collecting incidence data on skin injuries, particularly within the ICU, where we know we have a lack of data. These are just a few highlights of activities within Europe. But please visit our website, sign up to become an ISTAP member. Remember, it's for free. Then you will have access to our quarterly newsletter, podcasts, publications, knowledge assessment tools, and activities within your region. With that, a big thank you from Europe. Let's raise the awareness of skin tears. Let's go make a difference. Thank you.
And thank you very much to Annika for that great presentation. And we'll now just go into our presentation from our Regional Director for the United Kingdom, Dr. Ray Samario, who will be presenting in just a moment here.
Hello and welcome. Thank you very much for joining us for this year's International Skin Tear Advisory Panel World Without Skin Tears Day. Delighted to talk to you. My name is Dr. Ray Samario and I'm the United Kingdom Regional Director. So I'd like very briefly to give you an update on the work that I've been doing over the last. So I'm really privileged in the sense that the last year has been a very productive year. I've been able to take lots of work on behalf of ISTAP, but also to learn a great deal. So broadly speaking, I'd categorize the work that I've done into 5 main strands, which I think are at the heart of the work that we all do to try and achieve the goal of a world without skin tears. So basically the 5 things I've been focusing on the last year are around collaborating, learning, sharing, researching, and improving. So in terms of collaborating, I've been privileged enough to work with a variety of the other ISTAP directors, and we've collaborated together to try and share information and to learn from each other as well. But also I've been lucky enough to collaborate externally with colleagues here in the United Kingdom mainly, who are involved in research around healthy aging. So I'm lucky enough to be part of the advisory board for the Skin Microbiome in Healthy Aging Collaborative, also known as SMIHA, and that's given me the opportunity to collaborate with and learn from a variety of different other professionals, including medical colleagues, dermatologists, surgeons, biomedical scientists, but also people who do a lot of skin and hair related research. So that's been a really useful learning opportunity for me, but it's also enabled me to share the wider work that we do with regards to skin tears as well. Second, I said learning is something that's exciting. It never really stops. So it's given me the opportunity over the last year, I think, to be able to learn from colleagues through that network, but also from the other directors with ISTAP, but also collaborate with other organizations which are interested in improving skin health and also preventing skin tears. So a lot of learning. In terms of sharing, which I think is at the heart of what we all do, and building relationships, which are key to achieving good work. I've been lucky enough to present on behalf of ISTAP at a variety of different conferences. So first of all, I was lucky enough to be invited to present at the European Wound Management Association conference in Milan last year, which went really well. And I think our session on skin tears was well received. I was also lucky enough to present at a online conference for Wounds International, which again was on skin tears and skin tones, and that seemed to be really well received. And then latterly, towards the end of last year, I presented at a UK-wide conference called Wounds International in Harrogate, also known as Harrogate Conference for colleagues. And we presented a session there with Sam Holloway and Julia Bresnay-Harris. And the session that I delivered there was really quite engaging, and we got lots of really good feedback as well. So sharing information and sharing new insights and what we've learned, I think, is a really important part of our work. In terms of researching, it's been linking to colleagues. There are lots of colleagues in different parts of the United Kingdom who are doing lots of really good work. So it's been about supporting them where I can and contributing to the mission of the work that we are doing. So I think research is really important to make sure we've got the evidence to inform the care that we deliver, the education that we give to colleagues as well, and how we look after people to prevent and treat skin tears. And improving. So I think improving cuts across all the other four elements in the sense that it's at the heart of what we are doing. It's about trying to get better every single year. The final point I'd say is just to say thank you all for your interest in skin tears and how to prevent and treat them. But also thanks very much to colleagues from the UK who I know have written quite a few articles. So later on in the session today, I'll come back to you to talk about publications and other resources that we've put together for you. But thank you very much. I hope that's been a very useful summary of the work that I've been doing in terms of the United Kingdom. The other forthcoming event, if you ought to signpost, is at the beginning of May. The European Wound Management Conference, the European Wound Management Association Conference will be here in the United Kingdom in London. So I hope some of you will be able to join us there, and we'll be sharing alongside other colleagues a variety of different information and research on skin tears. So I hope you'll be able to join us for that. So that's really exciting. And last but not least, I would ask you to keep on spreading the message around skin tears. I hope you enjoy the rest of the day. I hope you find the sessions really informative. And if you'd like to get hold of me, my contact details are there on the slide. And please help us spread the message, really, that it's not just a skin tear. It's something that we can and should prevent. So thank you very much for listening, and all the very best.
And thank you, Ray, for taking us through that report from our region of the United Kingdom. We'll now move into our next region, which will be Latin America, and this was for Spanish. So we thank you to our regional director, Pia Molina here, who will be presenting in just a moment.
Hello, everyone. Welcome to A World Without Skin Tears webinar. I'm Pia Molina from Concepcion, Chile, and I am the Regional Director for Latin America of ISTAP. I'm glad to introduce to you the work done in Latin America about skin tears. First of all, when we talk about education topics, as a Regional Director of ISTAP, I participate in sub-webinars organized by skincare programs in different Chilean hospitals. The main objective was to collaborate in the training of future health professionals in evidence-based practice and skincare. In addition, last year in June, under the sponsorship of the Chilean Society of Intensive Care Medicine, we created the first Congress on Skin Care in Critical Ill Patients, where I had the opportunity to present a conference about the strategies for the prevention, classification, and treatment of the skin tears, including the first consensus for the skin care in critical ill patients. Last November, in San Jose, Costa Rica, Colmade held the third Latin America International Congress on Wounds, Stomas, and Incontinence, where the past president and past regional director of ISTAP discussed the differential diagnosis between MARSI, moisture-associated skin damage, incontinence-associated dermatitis, and skin tears. About the research topic, in May of 2023 and the UMA Congress in Italy, we presented two studies related to skin lesions during the COVID-19 pandemic. The first one was prevention of dependency injuries in critical pregnant women in prone position, and prevalence of skin injuries in critical patients with severe COVID-19 pneumonia. Also, for the last 2 years, we have been collaborating with the Chilean National Nursing Administration in the drafting of the Nursing Scientific Consensus for the Prevention and Management of Skin Lesions, including skin tears. On the other hand, this year, we are beginning a new challenge, the first multi-center study about the prevalence of MARSI and skin tears in Chile. It is very important to remind you that on the Skin Tears website, you can find the ISTAP Skin Tears recommended reading reference list. Some of the articles were made in Latin America by Latin American directors of ISTAP. But the challenge continues. I invite you to use the skin tear classifications available in Spanish, either in clinical practice or in skin care education. I also invite you to sign up as a member of ISTAP, where you can find documents in Spanish, such as las recomendaciones de las mejores prácticas en estrategias holísticas para promover y mantener la integridad cutánea, y las recomendaciones de mejores prácticas para la prevención y tratamiento de los desgarros de piel del adulto mayor. Finally, I would like to encourage to do research and report on skin care experience in Latin America. If you have any doubts, you can write us through the Skin Tears website. And thank you so much for being with us today.
And thank you, Pia Molina, for presenting that. That was fantastic. And we have another presentation from our Latin America for Portuguese, presented by Cynthia, which I will play in just a moment.
Hello, everyone. I hope you are well. I am Cynthia Bandeira, a stomatherapist nurse from São Paulo, Brazil. Today, I am joined with this excellent team of skin tears scholar to commit to a world without skin tears. Since the latter half of 2023, I have been part of ISTAP board representing Portuguese-speaking Latin America. My passion for addressing skin tears has been a subject of my academic career since 2016. Since then, I have been able to adapt the ISTAP classification instrument, a K2, in understanding and categorizing skin tears to Brazilian Portuguese, and participate in other studies and publications. In 2023, I surveyed to understand the Brazilian nurses' knowledge of skin tears. And during this research, I understood better that health professionals need to get closer to the subject in Brazil and in worldwide, delve deeper into it, and ensure prevention and adequate treatment for those who suffer from it. With this virtual conference on skin tears, I hope you can carry new knowledge and apply it to your clinical practice. Join us and strive for a world without skin tears. Thank you very much.
And thank you so much. We're now just going to go to our final regional director presentation before I invite Mary back on to introduce our final major presentation before we go into Q&A. So this will be Mary Hill from North America, who will be presenting in just a moment.
Hi, my name is Mary Hill, and I'm ISTAP Regional Director for North America, and this is the Canada update. Last year in Ottawa in 2023, at the Nurse Specialized in Wound, Ostomy and Continence Canada Conference, Dr. Kimberly LeBlanc presented on skin tears. As chair of the ISTAP Educational Committee, we facilitate the organization of the educational sessions for today's International Wound Without Skin Tear Day. I'd like to personally thank Jenny Prentice, Jay Shaw, and Cynthia Banderas for helping to facilitate, organize, and their dedication to the educational sessions for today. In January, there was a collaboration between Accelerate CIC and ISTAP for a webinar series. And I facilitated the first of 3 webinar series, Back to Basic Skincare. As a result of this webinar series, there will be an article published in the WCET in June. There was a presentation again by Dr. Kimberly LeBlanc on skin tears at the University Health Network Conference in Toronto this past March. Thank you very much.